Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Pranavasotas Vyadhi, and after Kas Shwas, we have focused on Pratishay, especially the Hetu Parivarjan, which is important in today's practice to have a complete and successful treatment of the Pratishay Vyadhi. Now we move towards a very important disease which has got importance academically also and clinically also. Almost all of us have written this disease in the exam right from the second year to the MOD final year also. And the disease is called as Rajayashma. All of us know that Dharana Dhatavaha, Dhatu are responsible for our dharana of this sharir, and in the Rajayashma these dhatus have a kshaya, and so dharan karma is hampered and ultimately patient lands in the danger zone. There is historical evidences or stories, we will not go in detail. We will directly move towards the main samprati of the disease, and there are three steps which are very important. Firstly, there is Kapha and Upalepa of this Kapha dosh in the strotas. Coating, Upalepa. So what happens that because of this coating in the strotas, Dhatvagni Mandya is created, and the aharas which reaches to the Dhatu strotas, because of this coating between Dhatvagni and aharas, Dhatvagni can't have any action on the aharas, so Dhatu Poshak Amsha cannot be formed, and hence Dhatu is not created. So what it leads to? It leads to Dhatu Kshay, first things, and as Poshak Amsha are not created, Malabhag is more produced. So because of this Upalep, Dhatvagni Mandya and Dhatu Poshak Amsha, hampering of Dhatu Poshak Amsha, and slow by slow Dhatu Kshay starts. Because this Upalep is in the sotas of all Dhatus. This is I have explained in a very simple, I try to make it simple, Samprati. Now, when the Lakshana are seen, they have categorized in the three categories: Trirup, Shadrup and Ekadashirup. Amsa Parsha Pitap, Santapa Karapadadah, Karapada Yoho, Jvara is Trirup. In the Shadrup, there is addition of symptoms like Bhatta Dvesh, Darshan, Kas, Pratishay, and in Ekadasha there is Daha, Atisar, Shula, etc. So details you must be knowing, or you can refer to the books. So Trirup, Shadrup and Ekadasharup indicate the more and more intensity of the disease, and more the number of symptoms present in the patient, he is more critical. Among all these symptoms of Trirup, Ekadasharup or Shadrup, there are physical signs, and there is nothing difficult to diagnose clinically. So in spite of going in that, I will have to discuss some symptoms which are very interesting, and I am going to ask you whether you have seen such symptoms in the patient. The first symptom which is seen, I have seen in the three patients, is Amsa Parshvavita. Generally, the disease of Pranavasotas, so we always see the picture of Kas, Shwas, Pratishay like that. But in the Trirup Rajayashma, Amsa Parshvavita, the Amsa at the scapular level, there was in the three patients I have seen which were diagnosed afterwards as a positive for the tuberculosis, where they have started the symptom of Amsa Parshvavita. Now at that level they were not having any Kasa or Shwasa or Pratishay, but slowly they developed loss of appetite, loss of weight and Jvara. But beginning was definitely with this Amsa Parshvavita, which is Lakshan mentioned in the Trirup Rajayashma. And it's a very interesting thing, because when a patient comes to you, with this symptom that I have some pain or burning sensation at this region, we always think of some frozen shoulder or some any abhigat or joint pain like amsa sandhi, etc. But it is very difficult to diagnose clinically that it may be a symptom of Rajeshma which is forthcoming in the future. And I have seen this symptom in 3 patients definitely. So this interesting fact I want to share with you that Amsa Varshavita, when the patient comes to you, I don't claim that every patient will land into Rajeshma, but in the back of mind you should have this Tridup Rajeshma Lakshan which is specifically mentioned in the text. The second interesting factor about these symptoms of Rajeshma mentioned in the text are all the psychological symptoms. See, physical symptoms, Bhaktadvesh, Shwas, Kash, Shunita Jwara, Angasar, we can easily manipulate and patient also tells you the symptom. But the symptoms which are psychological and they are mentioned in a very large numbers. In general, Arati, etc., the symptoms we see in diseases. But in Rajeshma, they have mentioned a list of psychological symptoms. For example, he finds something dirt in the food plate. He thinks that he has standing over the ash or bones or skulls. Then he finds he dreams that he is attacked by the snakes, monkeys, owls, etc. Then he also has a continuous views that he uh, observes his body measurement and he thinks that there is something uneven in his body measurement. Then he in the dreams he imagines that he sees that he is riding on the camel and dog and he is going in a very dry area, the city or in the village there is no one is living, etc., etc. Now many lines have been given to these psychological symptoms of Rajeshma, and the patient which I have seen or I have in the Rajeshma as such, I have hardly found any symptoms which are described in the text and which come under these psychological factors. I think either only physical other than Manas Rog, Rajeshma will be the only physical level disease in which so much of psychological symptoms are mentioned, but at least I have not seen them in by any way. I have tried to ask this to many patients, which I will explain in the next episode also, but I have hardly found these psychological symptoms told by the patient. So, if you have some any experience about such, I will like to have to share with all of us, and I will be happy to listen this experience. So, I don't know why these symptoms are mentioned and which are hardly seen. As they have mentioned this in detail, it means they have definitely observed these symptoms in the patient at that time. But nowadays, it is, at least by my experience, I have not seen patient definitely pointing to this dream-like symptoms or etc. The third symptom, which is also interesting, and in the theory paper in the second year, third year, always there is a question on this line that balam tasya bit balam. It means that as dhatusha is there, dhatu are not forming properly, malavag is forming in a more quantity. So bala is dependent on purisha, avashtamba purishasya, and the bala dharan is done by the purish in the Rajeshma patient. So don't give them viration. We may have written in that difference between Jirna Jora and Rajeshma. In Rajeshma, viration is contraindicated because Purisha is the only factor which holds the Dharan Karma of the Sharira. This symptom also I have tried to see in the patient, but hardly I have seen that patient is has some diarrhea and patient lands in a very critical condition just because of loss of pressure from the body. So other symptoms like Bhattadvesha, Jwara, Kasa, Angasada, uh, Shundra Darshana, Kasa, every symptom is seen in these patients, but psychological symptoms and Balam Dasabit Balam is at least I have not found in a significant way. If you have experience of such symptoms seen, please share, and I will happy to have to learn that experience. Then what actually Balam Dasabit Balam I demonstrate or I manage in the patients, and some other things interest about Rajeshma we will discuss in the next episode. Thank you very much.